Hello and a very warm welcome to our latest webinar, our 8th World Horse Welfare Wednesday Welfare webinar, which is quite a mouthful to say, of the year, which tonight is focusing on strangles. And you are joining us by Zoom, and you're very welcome. And thanks so much for joining us either live or on catch up, which is why I've determined not to say good evening, because you may be watching this in the morning if you're in the Southern Hemisphere now, or at any other time of day if you're catching up. So we're now also being joined by our team from Facebook. Very efficient tonight, Basil, thank you very much. And a very warm welcome to what is our 8th Wednesday webinar. And tonight we're focusing on strangles. And I'm delighted that we are being joined by Roxane Kirton from the RSPCA, and also to welcome back our own Sara Jerman, who's Assistant Centre Manager down at our Somerset Centre. So tonight is all about being interactive. So if you are joining us on Facebook, then please do share the live video. The format is that we have two presentations, one from Roxane to start with, which will be 30 minutes, then a 10-minute presentation from Sara, and then it's over to you. We open it up to questions. So if you're joining us by Facebook, please do put your questions on the comments section. If you're joining us by Zoom, then if you can use the Q&A function, that would be great. By all means, use the chat function to chat amongst yourselves and with the panelists. But if you can just keep the questions in the Q&A, it's so much easier for a simple guy like me to try and get those questions answered. And I know you'll have a lot of questions tonight. This is, as I say, the 8th one of 2021 webinar that we've run. All our webinars, including tonight, are or will be up on our YouTube site. So please do go and refer back to them and let your friends and colleagues know about them too. And we will be moving to monthly webinars over the summer and autumn. Until next winter. But if you've got any suggestions on what we might focus on in a future webinar, then please do send through those suggestions to education@worldhorsewelfare.org. As I say, we're moving to a monthly rota now through the summer, and our next webinar, which is the first in the summer series, is on how to provide a good life for horses, the importance of friends, freedom and forage. And that's on May the 26th at 7 p.m. in the evening, UK time or British summer time, with Professor Nat Warren from New Zealand and experienced event rider and producer of Young Horses, Sam York, plus a member of the World Horse Welfare team as well. And we'll play a link for that in the chat for you to sign up. So now is my job to share my screen and just to go into a first of a poll question. Now, if you're joining us by Facebook, unfortunately, you won't be able to answer automatically, but you can certainly put your answers in the comments function on Facebook. What experience of strangles have you had? Have you had a horse with strangles? Have you been on the stables where there has been, but your horse was unaffected? Are you aware of strangles but never seen a case, or you don't know much about strangles? This is literally not a test at all, just to give a feel for who's joining us tonight. And whilst you're answering that, I'll just give you a very small introduction for World Horse Welfare, a charity that was founded in 1927, focusing very much on the horse-human partnership. And there are various facets to our work, but in the UK, we run 4 rescue and rehoming centres and rehome over 300, in fact last year 356 horses we rehomed. But one thing that really binds all of our centres together and all of the charity centres with Roxane at the RSPCA and in her previous life at Red Wings and many others is strangles, and how you make sure we can keep our horses safe from strangles, and where we get it, because some of the horses that come into our centres do have it or are carrying it, then we can get them free from disease as quickly as possible. And that's what tonight's all about. I mean, strangles is a disease that sort of strikes fear into so many horse owners' hearts. It's actually a disease that we've known about for years. It was known about in the Middle Ages. And extraordinarily, Napoleon Bonaparte, actually, when he went into battle, he wanted an army of horses which have had strangles, because he understood that they were probably going to get strangles, and the best way of protecting them was to have that short-term immunity after having had strangles. So it's nothing new, but it still strikes fear. Why does it strike fear? Well, quite rightly, because it does cause so much suffering to our horses and us as owners. But it's also shrouded with so much fear and stigma. And we believe with more knowledge, more openness, and therefore less stigma, we could all work better to protect our horses from strangles when it comes around. And so I'm delighted that we've got Roxane and Sara to share their sort of thoughts with us tonight. And before I introduce Roxane, Basil, have you got the answer to the poll? So that's a great spread of answers there. 10% have had strangles, or their horse has. 16% have been in the stables where it has, but 60% are aware of it but never seen a case, and 15% who don't know much about strangles. Well, I hope all of you tonight, whatever category you're in, that tonight will be of real value to you. So I'm delighted to introduce our first speaker, which is Roxane Kirton, who has been in the charity sector for a good while now. She was at Red Wings Horse Sanctuary before. She couldn't quite remember. Over 10 years, I think, is the technical way of describing it. And she's been at the RSPCA for the past year, where she's got obviously major control for preventative health and disease control. There are many things I could tell you about Roxane, but I'm sure this will be shared with many of you too. That she has a great dislike of household chores. So she has trained her cob, called Audrey, to give her a hand fetching the laundry in. And apparently Roxane is going to show us a video of Audrey doing exactly that in her presentation. How we relate to that, to strangles? Stay tuned. Over to you, Roxane.
Thanks very much, Rowley. Yes, hopefully I'll be able to tie that in. And it all will become apparent. So I'm hoping that my screen sharing is working.
Yes, that's great.
Fabulous. Good evening, everyone. Thanks very much for joining us. Want to talk to you about equine strangles, as Rowley has already said, really exploring the realities of what is a very common disease for our horses, and one that the horse owning community generally fears. So why should we be concerned about strangles, and why should we be increasing our knowledge about it? Well, I think if the last year has taught us nothing, it's that we live in a global community, and while that has loads of benefits, there's also some drawbacks as well. And the global spread of infectious disease is one of those drawbacks. The more we move around, the more easily it is to spread infectious disease. And that's not just applicable to humans, that's applicable to our horses as well. Strangles is the most commonly diagnosed equine infectious disease worldwide, so it's really relevant. The only exception to this is Iceland, and that's probably because of a self-imposed ban on imports of horses. So Iceland is the only place that's actually clear of strangles. Between April 2020 and April 2021, there were reported 218 confirmed diagnoses, which is actually quite a bit lower than our average, which is on average, we'll see about 600 cases in the UK. And again, that was probably due to coronavirus restrictions that really restricted movement of horses around, reduction in competitions and sales and markets. So just a general reduction in movement has probably also helped to reduce the number of strangles cases that we're seeing. And you can see in the strangles surveillance scheme on the diagram there, it's just a graphic representation of the areas most affected by strangles in the last year. So you can see there's good spread across the whole of the UK as well. Strangles is really highly contagious. So in a susceptible population, anywhere up to 100% of horses in contact will get clinical signs of strangles, will get clinical disease. And although it's said to be a rite of passage in some cases and just something that horses get and get over, can actually be fatal in anywhere between 2 and 8% of cases. So can be very significant and can be very severe, even leading to the loss of life with some horses. And as well as that, we also see complications in up to 20% of cases. And those complications themselves can be fairly serious, sometimes even fatal. And as well as a welfare impact on our horses, there's also a really high economic cost impact. And it's been said that some outbreaks have cost up to £300,000 to manage. And obviously that's in things like care and vets fees, but also in loss of revenue for commercial establishments as well, when they've had to go on lockdown, they're not able to continue business as usual. So strangles is a disease with a big impact. And really the reason why we should be really interested in strangles is because actually its spread is preventable, and if we all improved our biosecurity and our knowledge on strangles, it would actually be possible to eradicate it. So it's just worth bearing in mind. So Rowley's already alluded a little bit to the history of strangles, but I just think this is really interesting that strangles has been around for a very long time. The first reported clinical signs of strangles goes as far back as in 1256, where it's documented by the farrier to the Emperor Frederick II. And then the causative agent was first identified in 1888. So we identified then it was a bacterial infection. And then, as Rowley said, around the 19th, 20th century, global conflicts that involved horses and the worldwide movement of horses and mixing of horses is thought to be responsible for the emergence of a new what we call fitter strain of strangles that we think that all current strains are actually derived from. So it was that global movement of horses around that time and mixing that really created that modern strain that we see now. And then in 1990 was a major development. It was the complete genome of strangles was sequenced. In 2017. The disease became reportable in the US. So it is reportable by law in some countries, not the UK though. And then in 2021, so just recently, there's been a paper looking at the global transmission of strangles and the relationship between strains identified in different countries, which really confirms that strangles is a global issue. So a little bit about strangles. It's a bacterial infection caused by the bacterium Streptococcus equi. It's an infection that affects the upper respiratory tract of equines. So it predominantly affects the lymph nodes of the head and neck, which you can see on the left-hand side picture there. So it's principally the retropharyngeal lymph nodes, which are the lymph nodes at the back of the throat, and then also the submandibular lymph nodes, which are those lymph nodes that you see under the jaw. And apologies, there are a couple of little graphic images throughout the presentation, but the image on the right hand side there is one where we've had an abscess in those submandibular lymph nodes from strangles that's ruptured out. So that's the kind of position of the lymph nodes that you're looking at there. So this is really important. It's spread by direct contact with infected material, and that might be either direct from horse to horse. So if a horse has got a snotty nose or discharging abscess, that's going to be draining infected material. If another horse comes into contact with that, they're likely to get clinical signs of disease. But it's also spread through fomites, which are just inanimate objects that spread disease. So things like our clothing, any equipment or anything contaminated in the environment. So things like buckets and hay nets, anywhere where pus has come into contact with where another horse might then touch afterwards, can be a source of a spread of disease. But it's not airborne, which is the great news, which makes it a lot easier to control the spread of. If we can control contact, then we can control spread. There are hundreds of different strains of strangles we know now we've typed it, and those strains differ in their severity and their virulence, so how much they spread and the severity of the disease that they cause. We know that strangles bacteria can persist in the environment for up to 6 weeks, but this has to be in the right condition. It's actually quite a sensitive bacteria, and generally it'll only survive for a couple of days on surfaces like wood and metal, and it particularly doesn't like being dried out. So it tends to be water sources or damp corners where it survives the longest. So we need to be thinking about that in terms of environmental contamination and disinfecting and cleaning down. Our water sources are a really important source of infection for other horses. has an incubation period of anywhere between 3 and 14 days. It can then be anywhere from a day or two right up to 28 days. And that depends on the amount of bacteria that the horses come into contact with, and then the susceptibility of the horse. So if it already has some immunity, the incubation period may be longer. If it has no immunity and it comes into contact with a really high dose, and the incubation period might be much shorter. The reason why we need to really understand about incubation period is because when we're isolating our horses, we want to make sure we isolate them for at least that standard incubation period to give time for any clinical signs that might be developing to emerge during that period of time, so we can control disease spread. Strangles tends to be worse in young or debilitated horses, so any horses that have any other illnesses. Although the Strangles Surveillance Scheme reports that the average age of positive horses is actually 9 years old, which I think really demonstrates that it isn't just a disease of young horses. Any horse can get it at any age. And we'll talk a bit more about this as we go on, but it has some very clever methods for persisting in the horse population. It's a very well evolved bacteria for what it does, which is why it's been around for so long. So disease progression, this is generally what happens, and strangles is quite a complicated disease. So we have our exposure to disease. Generally, we'll have an incubation period. So during exposure, we get bacteria. They tend to enter via the nasal cavity or the mouth. And what happens is they straight away, they squirrel under the lining of the nose and the mouth, and they head straight for those lymph nodes in the head and neck that we talked about. So they disappear very quickly. And then what happens is we start to see signs of acute infection and clinical disease. So this is where it really sets up in the lymph nodes, and we'll start to see bacterial shedding during this stage, and that generally lasts for 2 to 3 weeks while we've got clinical signs. And then what happens is our clinical signs generally resolve. Hopefully our horses recover, but this is a completely normal part of the disease process. We will often get short-term shedding following the resolution of clinical signs, and this can be anywhere up to 8 weeks. So it looks like the horse has recovered, but it can still be shedding bacteria, so it means it can still be infective to other horses. And this is why it's really important that we test our horses following recovery before we release them back into the general population, because even though they look recovered, they may still be infective to other horses. And in a small percentage of cases, actually, they can go on to develop into long-term shedders and actually carrier formation. And that might be for months or even years that those horses remain asymptomatic but infectious to other horses. So that's a really important component of the disease. It's these carriers that perpetuate the disease in the population. So clinical signs will vary from severe to quite mild, so they do vary, but the classic signs and the most reported signs for the Strangles Surveillance Scheme in this order are nasal discharge. So this tends to be a really thick yellow purulent discharge, usually from both nostrils or from draining abscesses where they've ruptured out through the skin. Also a temperature, so we see a quite high temperature, and that can make our horses feel really quite poorly, and they'll go off their food. Really interestingly and importantly, the temperature generally comes before the other clinical signs, and actually they'll get a temperature often before they start shedding bacteria and being infective to other horses. So if we can monitor temperatures in an outbreak situation, we'll often pick up horses and be able to isolate them before the spread of disease happens. And then we get this glandular swelling. So once our bacteria have reached our lymph nodes, they set up these abscess sites, and we'll get this swelling under the jaw and at the back of the throat there, which you can see in this picture here. And then coughing, and that's associated with compression of the back of the throat and the airways. And this can also cause problems with eating and swallowing and laboured breathing. And actually, even if the glandular swelling is big enough, can actually cause asphyxiation or suffocation as well in the most severe cases. Thankfully, that's not very often. That's worst case scenario. And generally what happens is the abscesses progress, they'll rupture, and as soon as they rupture and start to drain, the horse will start to generally feel better. So what happens afterwards? Well, hopefully we want full recovery. And what's worth noting here is that we'll get a good immunity to short-term reinfection in about 75% of cases. But actually, in anything up to 25% of cases, we get really poor immunity to reinfection. So just because a horse has had strangles doesn't mean it can't get strangles almost immediately again. So that's really worth bearing in mind. Again, exposing them to strangles so they have a long-term immunity is not an effective strategy. So not one that we would endorse. Or the other option is that they may develop carrier status. So this happens in about 75% of outbreaks, and in 10% of horses that have had clinical signs of strangles will go on to become long-term carriers unless we intervene and treat them. And the secondary complications are principally purpura hemorrhagica and metastatic strangles. So this tends to happen after the recovery of clinical disease. So purpura hemorrhagica is an immune-mediated complication. So this is actually caused by the horse's own immune system following strangles going a bit awry, and it starts to cause damage to blood vessels. So it starts to create a vasculitis. And clinical signs can vary from mild to quite severe and even fatal in the worst cases. And the damage to the blood vessels causes fluid to leak out of the blood vessels into the surrounding tissue. So we tend to see signs like swelling of the head, limbs and body, and it tends to be gravity dependent, so the underside of the head and the underside of the body, and then the lower limbs. And hopefully you guys can just appreciate in the picture on the left there that there's a bit of swelling of those limbs. And this horse has purpura hemorrhagica following strangles. We can also see bleeding into the gums, so discoloration of the gums, and accumulation of fluid in other tissue in worse scenarios that creates difficulty in breathing if the lungs are infected, things like muscle soreness and colic, so depending on where the fluid is leaking. And in bad cases, we'll often sometimes see oozing and even sloughing of the skin as well. So these guys really need veterinary attention, and treatment really revolves around anti-inflammatories, usually steroids, and supportive care. So the other complication is metastatic strangles, and this is where we have strangles that spreads to locations in the body other than the head and neck and sets up abscesses elsewhere. And this can be anywhere in the body, but the most common sites are in the lungs, in the abdomen and in the brain. And clinical signs really depend on the location of where these abscesses form and whether or not they're impinging on any organs in those areas too. So clinical signs can generally, the kind of general signs are often intermittent temperatures and generally being a bit off colour intermittently, but we can get more severe signs depending on the location of the abscesses as well. This can be much more challenging to diagnose because we don't have any of the normal outward signs of strangles. So it can be more challenging and it's a lot more challenging to treat as well. Abscesses are notoriously difficult to treat with antibiotics because of the poor penetration of the antibiotics. So actually results in quite a high fatality rate, metastatic strangles. And it's hypothesized to be linked to antibiotic use during clinical disease of strangles, but actually there isn't any supporting evidence of this. So possible reasons why metastatic strangles occurs is probably due to strain type of the bacteria. If we've got particularly nasty strain type, maybe the dose that the horse has been exposed to initially. If they've had a very high dose, it might be more predisposed to spreading out of the normal kind of zones of the head and neck. And potentially some horses are likely to be more susceptible than others as well. So it might be those horses that are more susceptible that we see this issue with. So I said we would talk a little bit more about carriers, and I think this is really important to understand because carriers are really the secret weapon of strangles. Carriers occur in about 75% of outbreaks, and in about 10% of infected horses will become long-term carriers. So carriers develop when abscesses form in the retropharyngeal lymph nodes, so there's lymph nodes at the back of the head. And what happens with those lymph nodes is when they rupture, they generally rupture in the way into the horse's guttural pouch. Now, like a lot of things with horses, the guttural pouch is a fairly poorly designed structure. So the guttural pouch is just a blind ending sac of what was formerly the eustachian tube, which would have attached the back of the throat to the ear. But in horses, it just ends in this blind ending sac. So it goes down and drains down into the back of the throat. So the lymph node abscess ruptures into the guttural pouch, into the floor of the guttural pouch. It drains into there. So the purulent material accumulates. And when the horse puts its head down, the pus drains into the back of the throat and down the nose. And that's where we get the snotty nasal discharge from. But the drainage angle is not the lowest point in the guttural pouches. So what happens in about 10% of cases is some purulent material remains in there, doesn't drain out. The abscesses heal up, the horse looks like it's recovered, but it's still got this material inside its head, just rolling around. And over time it dries and it rolls around and it forms these pebble-like structures, which you can see in that little clip on the right hand side there, and they're called chondroids, and they can vary. So some horses will only have one or two, and it might just be they have a guttural pouch on each side of their head, so it might just be one pouch that's affected, or in some instances when they're really severe, there can be hundreds and hundreds of chondroids, but thankfully they tend to just be one or two. Now, what's really important about these guys is they are completely asymptomatic. So you can't tell these guys from the outside at all. They don't show any clinical signs. They're not poorly, but they just have these little pebbles inside, which are mostly pus and bacteria. And then during periods of stress, so things like moving in with new horses, they'll start to reshed the bacteria and become infective to other horses. So these are the guys that often trigger an outbreak because they show no clinical signs. So we can't take preventative measures. And then if they're introduced to new horses or new horses are introduced to them, then generally they will trigger an outbreak. So how do we diagnose strangles? Well, we can go from the clinical signs if we're pretty confident with those lymph node swellings and abscessation and temperature. Those are fairly classic. So we might not need to take any samples. We might be really happy that we know, or we're pretty certain that we have strangles. But if we're not, then we might choose to take some samples and confirm a diagnosis so we know what we're dealing with. Or we might be screening new arrivals coming onto site as part of our biosecurity protocol. So we've got several different options, and sampling is quite complicated, but I think it's important just to run through it. And I think the take-home message is, even if you don't remember everything I say here, is just that there's different techniques and they're appropriate for different stages, which is why your vets might choose one sample over another depending on the situation. So we can do blood sampling, and we can do nasopharyngeal swabbing, so literally popping a swab up the nose, a long swab up the nose all the way to the back of the throat. And then we've got a guttural pouch endoscopy too. So this is where we're putting an endoscope up the nose and having a little look in those guttural pouches to see what's going on in there. And the tests associated with this are, well, we're doing the blood sampling, it's serology. So what we're looking for is, we're not looking for the bacteria itself, we're looking for the horse's immune response to the bacteria. So what's important to understand about serology is it takes a little while, there's a little lag phase before we'll get a positive result after exposure. So you can just see this is a little graph I drew, so not completely accurate, but it's just to give the idea that on day 0 they'll be negative, and it takes about 10 to 14 days for them to seroconvert, so that for them to become positive. And then what we know about them is that generally once clinical signs have resolved, they will start to decline again. And most horses will remain seropositive for about 6 to 8 months following clinical disease. But after that, most of them will be seronegative again. So if we sample them after that 8 months, they'll be negative again. And then for our nasopharyngeal swabs and guttural pouch endoscopy, we're actually looking for the bacteria themselves. And we can do this through bacterial culture, so we're growing them. As I said before, strangles bacteria are quite sensitive, so we just need to be careful with our sample handling, because it is possible that we could kill off the bacteria before they make it to the lab if we don't handle them very well, and then we'll get a false negative result. And the other option is PCR, which is where we're looking for tiny fragments of the bacteria, which is a really sensitive test. And the main concern with PCR really is that if we are not careful with doing things like cleaning down and disinfecting our endoscopes or bits of equipment, then it doesn't take very much bacterial DNA to get a positive result on a PCR. So it is possible to get false positives with those if we've got contamination. So good hygiene is really important. So this is just to go, I know there's a lot of information on the slide, so it's just to go through when we might choose which kind of sampling that we're going to do. So during our incubation period, all of our tests are likely to be negative. Remember I said that immediately after exposure almost, the bacteria squirrel away inside the head, so they're not shedding at that point. So we're not likely to be able to find the bacteria on either nasopharyngeal swabs or guttural pouch washes. And our blood samples are going to be negative because they haven't had that time to seroconvert yet. So our best bet during our incubation period is to quarantine our horses and temperature check them regularly. So at least probably twice a day. And then as soon as we spike a temperature, we isolate that horse, and hopefully then we've stopped the onward spread of any clinical disease that might be coming. During our acute infection, we're going to have our clinical signs. So they may be enough to perform a positive diagnosis. If not, nasopharyngeal swabs are likely to be positive at this point because the horse is shedding bacteria. Guttural pouch washes may actually be negative until our retropharyngeal lymph nodes have ruptured into them. And our blood samples are likely to be positive at this stage as well. During our short-term shedding phase, so this is immediately after resolution of clinical signs, we're not going to have any clinical signs, and at this point nasopharyngeal swabbing becomes less reliable, so it tends to be more intermittent, and when we're looking for short-term or long-term shedders, generally what we advise is to do a minimum of 3 negative nasopharyngeal swabs a week apart, and that's because we're looking for these intermittent shedders. So we might have a negative, a positive, and negative, that would tell us that we are still shedding bacteria. So for short-term and long-term shedding, really the gold standard is guttural pouch endoscopy, and that's because we can have a look around and we can take a wash, and those are the areas that are most likely to be infective. Our blood sample will still be positive during short-term recovery. We may be starting to see a decline in how seropositive they are. And then in our long-term carriers, remember if it's over 8 months, then these guys may also be negative on a blood sample too. So again, when we're looking for long-term carriers, blood sampling will pick up a proportion of them, but guttural pouch washes and endoscopy is really our gold standard. So I'm not going to talk too much about the management, because Sara is going to talk to you about that. But the one point I do want to make is that if we have a case where we are suspicious of a infectious disease, isolate immediately and stop all horse movements. It's so much easier to relax measures if we get a negative than it is to wish we'd put in those measures earlier, because by this stage they'll already be spread and the horse will have already bolted. So it's much easier to put immediate restrictions in place and relax them afterwards, if hopefully it's all clear. Barrier care is obviously really important. We know how it's transmitted. It's transmitted on clothing, buckets, anything in the environment that snot can get to, has a potential source of infection for another horse. So we need to be really careful, good hygiene. And then veterinary treatment and diagnosis. So really, the principle is good nursing care with these guys, but they're probably also going to want anti-inflammatories to help bring down their temperature, improve their appetites, and things like that. So antibiotics are a bit controversial. Generally, they're not required and they're not indicated for cases of strangles. And that's for a few reasons, really, which is antibiotics, once the abscesses have actually formed, are fairly ineffective. So they don't have good penetration into the abscesses. And actually what they can do is just delay the maturation and rupture of those abscesses. And like I said before, generally once the abscesses rupture, the horses look and feel a lot better. So we don't really want to delay that process if we can help it. But there may be times when antibiotics are indicated if the horse is particularly sick or has other complications. The vets may decide to use them, but it'll be on a case-by-case basis. We wouldn't regularly use antibiotics in strangles. So management and treatment of asymptomatic carriers. So I think these are probably what scare people the most. And The great news is for most carriers where they've only got 1 or 2 chondroids, treatment is actually relatively straightforward and simple. So what you can see in the video there is a chondroid sitting in the guttural pouch, and what we've done is gone in with the endoscope, popped a basket wire forceps down there, and you can see it's a bit like an arcade game of hook a duck. We snare that chondroid and pull it out, and then it's really just a case after that of giving the pouch a really good flush out to just get rid of any remaining debris, and then resampling the horse maybe a week, 10 days later, just to make sure that it's now negative. There are some cases where they are more complicated if they've got a lot of chondroids, or they've got very, very large chondroids that don't fit out through the guttural pouch openings. Then surgery may be required, or occasionally if there's high levels of contamination, we may want to put indwelling catheters into those guttural pouches so that we could do a series of daily lavage. But generally, most of them are relatively straightforward to treat, and I've treated quite a few of them in my time working in the welfare sector. So there is also a vaccination, which I want to briefly talk about. So Sara's going to talk to you a lot more about biosecurity and prevention. But vaccination, there is a vaccine available on the market, licensed in the UK. It's not widely used, I think mostly because of the method of administration, which is submucosal. So it's administered into the upper lip, which you can see in the picture there. And not many horses really willingly partake in that. And it needs boosting really to maintain immunity every 3 months, so it is quite frequent. It's a live attenuated vaccine, which means it's the bacteria itself that's been altered so that it can't spread, but it does cause quite often a local reaction, and it can make the horse a little bit off colour for a few days. Like any other vaccine, it's not always 100% effective. And the other complication is if we were to use it in the face of an outbreak is currently we're unable to differentiate whether a horse has been vaccinated or whether it's had natural disease, which makes outbreak control and whether we should be screening for carriers quite difficult to differentiate. But there is a new vaccine coming onto the market hopefully quite soon, and that's going to be an IM vaccine. So that'll be quite interesting to see whether horses find that easier, horses and horse owners find that easier. And what I would just say about vaccines is that they're not a substitute for good biosecurity and infectious disease management, but they are a really useful and important tool in the toolkit, particularly for high-risk horses that are maybe traveling around more or mixing more. So if you think that your horse might be high risk, it might be worth speaking to your vets about potentially incorporating vaccines into your disease control strategies. So prevention and control, and this is where hopefully things will become clear. So really, it's about having good biosecurity measures in place at all times. So really considering the potential spread of infectious disease, keeping the place neat and tidy. And I think this is where if you're not very good at tidying up like me, you might want to get your horses to come and give you a hand. But really quarantining and screening new arrivals, and what you're looking for there really is any horses in the incubation phase or any of those secret carriers that might be coming onto the yard. So if you're not sure about horses' previous disease status, then you might want to test them and screen them to see. It's really important to have an effective outbreak control plan in place, and this is really ideally before any issues arrive. That's when you're going to be most able to make a good, clear plan about communication, who's going to be responsible for what and how you're going to address these issues. So it's cohesive and coherent, and everyone understands what they're supposed to be doing, which is really the secret to success. And then really testing following recovery. What we want to do is we want to identify and treat those carriers before they become long-term carriers and have the potential to go and infect other horses. And I think, as Roly already said at the beginning, good communication is absolutely vital. We need to lose the stigma of strangles, and when we have problems, communicate effectively so that everyone is aware of what's going on and there's not the risk that someone's going to inadvertently spread the disease. So just a quick recap, strangles is endemic worldwide. No horse is immune. It can affect anyone. It really can. No biosecurity measures are ever going to be 100% effective, but the more measures you can implement and the more careful you can be, the more you're going to lower the risk that it's going to happen to you and your horse. Due to the way it spreads, so that direct spread, it can be controlled relatively easily. So if we can prevent a contact, then we can prevent spread. Prevention is always going to be better than cure. So it's much better to have these measures in place before we have an issue. And fast action and good communication is absolutely vital to preventing further spread of disease. And the better biosecurity you have, it's not just strangles that you'll be protected against, but lots of other equine infectious diseases as well. So thank you very much. There's just a few references if anyone is interested from a few of the facts and figures in the presentation.
Roxane, thank you very much indeed. That's brilliant. I mean, normally I have to tell people to make sure you put your question and answers, or questions, sorry, in the Q&A function, but no holding you back all tonight. So just for that, so Roxane, thank you. There's plenty of questions, so we'll look forward to coming to those. And just to remind people, if you're on Zoom, you can upvote those questions. So if you've got a question, great, please put it in. But if a question very similar to yours is already there, then please do just upvote it. It is extraordinary to think that Iceland hasn't imported a horse in over 1,000 years. I could make a facetious comment like the UK through Brexit is doing a good job to reflect that as well, but that wouldn't be appropriate, so I won't. Thank you, Roxane. That is superb. We always ask where people are from, and it's great to see from Canada, US, and Mexico, and then across Europe from Spain, Greece, Finland, and of course the UK as well. So wherever you're listening from or watching from, if I haven't said where you're from, then please do put it in the chat function and let us know. But it's great to have you with us. So now, before we move on to our second speaker, I'm going to share my screen again, and we're going to have a second poll question, which is clearly slightly led by Roxane's presentation. We were thinking of asking this before and after to see how your answers changes. But if you suspected a horse on your yard had strangles, which answers best describes what you would do? And there's 4 options there, from isolate the horse, or carry on as normal and not isolate the horse, and a couple of answers in the middle. So we've slightly given you some assistance, and that again, there is, well, I suppose with this one there probably is a right answer, and we'll just see on the back of Roxane's presentation whether you've got that. Thank you to Roxane, and now I'm delighted to introduce our next speaker, which is Sara Jerman, who is Assistant Centre Manager at our Somerset Rescue and Rehoming Centre, and has been with us since 2007. As you can see, a standard World Horse Welfare, initially groom and now Assistant Centre Manager, because she's a human holistic massage therapist and an equine shiatsu practitioner, which is marvellous and hugely valuable sometimes. I can assure you that input into our rehab process. But one thing you probably don't know about Sara is the fact that she's often known as the crazy cat lady, and lots of the team down at Glenda Spooner Farm in Somerset can often ask themselves why she doesn't work for Cats Protection instead. Well, I, for one, am very glad she doesn't. But before I hand over to Sara, Basil, have you got the answer to our question? Look at that. So actually interesting that some would isolate the horse and any in contacts, but not lock down the yard until you know for sure it strangles. Just come back to that line that Roxane put in, actually stopping movement and as a first step for any significant disease outbreak, will always pay dividends. It can be a real pain at the time because it obviously impacts the day-to-day work of the yard and everything else, but it honestly does pay dividends. So thank you so much for answering that. And without further ado, I'm going to stop sharing my screen. And Sara, over to you.
Thank you very much, Rowley. Okay, hello everyone. So I'm just going to echo a little bit about what Roxane said, but talk more about isolation and what we do at the centre, but also what you can do as horse owners. Sadly, as Rowley said, there is often a stigma surrounding strangles, which can prevent owners that are affected from being open about an outbreak. It can often strike fear into people, sometimes through a lack of knowledge or sometimes from scaremongering. However, with fast, thorough action, it can be prevented from becoming worse than it needs to. And it can happen to any pony, any horse from any background. And I think the last year with COVID-19 has affected everyone in some way. It's really shown the reality of how fast an infection can spread and what happens when it's not addressed. And I think putting biosecurity measures in place has shown that as well. And we can slow down and often halt a disease. And then we can relate this to equine diseases such as strangles. So it's really important to let people know if you suspect that your horse has strangles, and don't keep it to yourself, as this can increase the risk of spread. As a private horse owner, let people know, such as your farrier or your neighbouring yards, equine properties, if you have a suspected or a confirmed case of strangles. You'll call your vet for advice, and obviously they'll come out and examine the horse, and your vet is likely to take samples, as Roxane said, and then they'll go off to a laboratory and be diagnosed to give you the answer. The best practice for a livery yard is to have a strategy in place before an outbreak. And this is something that's really important, that all staff and liveries are aware of. The plan should include, to start with, who's responsible for putting that plan together. Would it be the yard owner or the yard manager? And making sure that everyone is on board with that. So if you have new liveries in, they know about it, and all your staff know about the plan and what to do should the worst case happen. How is that plan going to be implemented with regards to things like the number of horses you have, the type of yard, the yard facilities, and the movement for staff and liveries within that yard should the worst case happen and you get an outbreak of strangles? Making sure that you have the necessary equipment on standby or easily accessible. So things like buckets, hay nets, tools that you need to use separately for each horse. And most importantly, using a traffic light system for horses in suspected cases and those with confirmed cases. So horses that will be on green would be those that haven't been in contact with other horses showing signs. So what would you do with those? Would you put them all out into specific fields so they can live out whilst you've locked down your yard? Amber horses are those horses that have been in contact with potential carriers or horses that have shown signs. These need to be isolated in another area, so stabled. And the red horses are those that have symptoms or positive to guttural pouch washes. And again, they need to be stabled as well. So think about the yard that you're at and how would that be implemented? The other question to ask is, how are you going to organise your vets? So livery yards often have a variety of vets. In the ideal situation, there should be a lead vet that could liaise with other vets, but this needs to be decided as sort of forward planning. Because, as I said, most yards have many vets. Isolation procedures are put into place until all negative results come back, and there should be zero horse movement into or out of the yard. Keep a really close eye on all the other horses in the yard for any potential signs of strangles, such as Roxane said, nasal discharge, lethargy, difficulty eating, your swollen lymph nodes, or coughing. And it's vital to check their temperatures at least twice a day, because any rise in temperature could be an early sign of strangles. So that's for all the horses in the yard. So barrier nursing to prevent the spread of strangles should include things like clear signage, boundaries, so either boundaries that are actual sort of permanent things or ropes to stop people going in and out of areas, buckets of strong disinfectant for tools, and foot dips. So you want to have your foot dips outside all your areas, outside all your stables. Use spray bottles because you can clean off things like wheelbarrow handles and tool handles, and any rubbish or bedding that you have need to be kept separate and ideally burned straight away. Each person handling the horse should wear a disposable coverall with a hood. If you don't have a hood on it, then use something like a shower cap. It's so easy to move your hand and touch your hair that you really do need to make sure that that's covered. And you want boots, wellies preferably, that are easy to dip into disinfectant, and to wear disposable gloves. Again, leaving separate pairs of boots and obviously everything, all the overalls and things in a separate area, so you're not moving any kind of infection out of the zone. We know about hand gel. We've got plenty of that at the moment. So again, if you don't have hand washing facilities, if you don't have a sink, hot water, then do have plenty of hand gel around so that you can wash your hands before and after coming into an area, and have a change of clothes, especially if you're going to see other horses. Again, ideally shower before you go off to see another horse and change your clothes so you're not taking anything with you. So in the ideal world, all horses would have all yards would have an isolation area for new horses as well as for disease, either a self-contained yard and stables with a paddock, or a single stable that's set away from the rest of the yard. This isn't always possible due to constraints of buildings, but even a well-separated paddock away from others can mean new horses can be isolated. If you don't have a separate unit and you have to isolate for a strangles case or a suspected one, you can even cordon off an area around a stable, but it needs to be at least 10 feet away from others. And it might be that you need to not use the stables either side so that there's plenty of room. Any form of isolation is better than nothing. So at the centre, because of the nature of the horses we have in from unknown backgrounds, we apply a strict isolation policy as soon as they arrive. Many of them are weak and sick already and have come from very poor conditions. This makes them more susceptible to disease. Any new arrival will do a minimum of 14 days in isolation with a vet check, either immediately if medical needs warrant, or on the next visit, which is always weekly. If we have a horse showing outward signs of strangles, such as nasal discharge, it's really important that none of this gets passed on via touch or clothing. So our protective measures include a completely separate isolation unit, well away from the main yard. All of our tools, buckets, grooming kits, bedding, forage and clothing are kept in this area, in the room or in a box, so that there's no danger of transferring infection. Because the horses we have in are higher risk, we now tend to use guttural pouch washes, which Roxane talked about, rather than the blood test, because it gives us a more accurate picture. And the majority of the horses that we do have in don't show any outward signs of strangles, but they could be carriers. And we have had carriers in that we've had to guttural pouch wash and then keep them in isolation for several weeks. So they might have multiple washes over several weeks until they're clear. They'll then have the antibiotics or anti-inflammatories, and they'll continue to be flushed, and then they'll have another wash to prove that they are clear. This cycle can be repeated several times until a lab result comes back that they are strangles negative. If they have a clear guttural pouch wash on arrival, and they're not strangles carriers, they could still be incubating the disease. So it's really important that they continue with that 14-day isolation to make sure they don't have any signs of it. As Roxane said about the carriers, they don't show any outward signs, but they can persistently become infected in the guttural pouch. It's not always completely eliminated. So, and the bacteria can survive for sort of quite a long time. So we tend to keep the horses in isolation for that period until the vet says it's all clear, and then move on from there. So the cleanup afterwards is really important. So when the yard and the vet has given the all clear and the yard can come out of lockdown, don't forget that strangles can survive on equipment for a long time, as Roxane said, also in water. So make sure you disinfect everything thoroughly. You're going to burn your bedding and you're going to burn your rubbish. You're going to keep everything separate, and all your stables, your doors, your windows need to be disinfected. Wherever the infection has been. Ideally, use a pressure washer if you can with hot water and disinfectant. Make sure you do all your windows, the inside of the doors. If you've got rubber mats, take those out and disinfect those as well. And remember to disinfect and wash your clothing, your rugs and your head collars. So looking at minimising your risks, make sure that all your horses go into isolation for at least 14 days. We used to do 7 days, but it's now 14 days at least. Think about cleanliness all the time. So pre anything talking about strangles, cleanliness in a yard is important. So in your normal yard day to day, keep it clean. In your isolation areas, keep it really clean before, during and after any infection, and do make sure you disinfect everything thoroughly. And just do think a little bit about when you're at a show, obviously not using communal water troughs, and also thinking about when you're standing next to other horses, try not to come into close contact with them, because if they sneeze or cough, they could be spreading infection there. And just a final thought, when you go and buy a horse, find out a little bit about the history of where it's come from, and also look at the purchase facilities. There are so many places that we can buy horses nowadays. There are a lot of sort of yards that buy and sell all the time. Is that yard clean? Do all the horses look well? What procedures are in place for those new arrivals? Many of horses arrive from abroad, so what sort of processes have they got in place with those horses there? And most people get a vet check done, and hopefully the vet would spot something when they have that check done, and you could get blood tests done at the same time. But when you move them to your yard, it's important that you use those isolation procedures there. If you're rescuing a pony, which is quite common nowadays, you're likely to have them in poor condition, and you probably don't have any history. So have you got the facilities to isolate when you take them home? That's something you to really think about before you buy. And if you use these simple rules, and never afraid to report a suspected case, because it's better to be wrong than for your horse or more to be affected by strangles. Thank you very much.
Sara, thank you so much. That was absolutely brilliant, and a really good sort of supplement and follow on from Roxane's presentation. Blimey, I hope you two are up for a challenge. We've got lots of questions coming in. Before we get to that, you might not recognise it, but we are almost into May, the 5th month of the year, which is a frightening thought in itself. But next week is Strangles Awareness Week, which is going to run from the 3rd till the 9th of May, and a number of charities and organisations are getting together, including World Horse Welfare and the RSPCA, led once again brilliantly by Red Wings Horse Sanctuary. And this is an opportunity just to sort of give some support, develop that support network around strangles for horse owners, yard managers, vets and equine professionals, and to share their experiences, and also and very much building on what we've heard tonight, and to support each other. And there is, if you were joining us last week, we had a talk on biosecurity in Scotland. Tonight is on strangles, and you've got to go for the full triumvirate, because next week there's also another webinar which is going to be given by Dave Rendell, and that's as part of the Stamp Out Strangles Week. So we're going to give you a link to the Stamp Out Strangles, or the Strangles Awareness Week Facebook page, and also if you want to sign up to that webinar, and we'll give you a link to do that as well. Right, okay, so eyes down, and we're going to kick on for some of the questions. Roxane, if a horse is reinfected after initial illness, would the severity of symptoms be the same, less or greater than in the first infection? That's from Helena.
Oh, that's a good question. And I think it really depends on the level of immunity that the horse has had from the first infection, which is really difficult to determine. Some horses will mount a really good immune response, which may mean that they have much lesser symptoms the next time around, but others will be equally susceptible, particularly if there's maybe a different strain type. We could see very similar levels to the first infection, or even worse if it's a more virulent strain type. So it depends, I think, is the answer to that.
Brilliant, yeah, absolutely. And Harriet's asked, is metastatic strangles only ever secondary to traditional strangles, or can it be experienced in isolation?
I think the answer to that is really it's only ever secondary to your kind of classical clinical strangles. I would say it would be incredibly rare to have an occurrence of metastatic strangles where there hasn't been a case of clinical strangles. Having said that, there can be quite a duration, depending on the location of the abscess and how much problems it causes for the horses, between the clinical signs, the initial clinical signs, and clinical signs of metastatic strangles occurring. So it might not be immediately afterwards. It could be several weeks or even months afterwards, depending on the location of the abscess.
And is there any understanding of why a horse will go from standard strangles to metastatic?
The answer to that is no. I don't think we are fully informed about why. The hypotheses, probably the best ones are it's maybe to do with the strain type of strangles, that some are more virulent, more likely to spread systemically. Or it may be a host susceptibility issue. If the host is a bit immunocompromised, they're not able to contain the strangles bacteria to the head and neck lymph nodes like they normally would. Or it may be a dose related thing. So if they have a really high initial dose, again, it may be more likely to spread systemically. But what we do know is there's no evidence to support the fact that the use of antibiotics during clinical disease precipitates metastatic strangles. So no current evidence to support that theory, which I think is bandied around quite a bit.
Brilliant. And I'll come to Sara in a second. One more for you, Roxane. What are the implications for mare in foal catching strangles?
To be fair, I don't think that the implications are really any different from any other horse. If they are very significantly ill with strangles, then that does have a risk of affecting the pregnancy. And again, if there's complications, that's likely to affect the pregnancy. So really, we want to avoid contact with infectious diseases in pregnant mares. But having said that, if you are unfortunate and a pregnant mare does get strangles, the main thing is that the vets are on board and it gets treated efficiently and managed, the best you can. And hopefully your male and foal will get through the ordeal without any problems.
Brilliant. Sara, you mentioned several times disinfectant, and a question through Facebook. What's the best disinfectant to use on a yard?
We use Virkon because it's recommended for those types of infections, but obviously there are other makes on the market, and I think if you went to your local sort of agricultural store, they would probably guide you with that. But hot water, I think, so boiling, sort of hot, if you can steam wash things, that's very effective as well. Roxane, is there any difference with that? I think
no, completely agree with that. I think the only thing I would say is that no disinfectant is very effective where there is heavy organic contamination. So if there's a lot of feces or mud, no amount of disinfectant is going to penetrate through that. So having things clean before you're disinfecting them is very important.
You see those images around the world of people with COVID, them just going around spraying things in the street, and I always wonder, it probably makes people feel better in themselves, but I'm not sure how much actually good it does against a virus. But anyway, we're not here to talk about that. Madeline very quickly has asked Roxane, does it affect only equine species? No, does it affect other equine species or just horses? Which is a great question.
Yes, it does. It does affect donkeys, ponies, horses, and I do also believe, although I have no personal experience, that it might also affect zebra and their hybrids.
It does indeed. And of course, donkeys so often, like in so many diseases, can be more often be carriers, can they not?
Yeah, so the severity of clinical signs sometimes varies. So donkeys won't necessarily always get such severe signs, so it may be missed as well.
And Sara, Mary has asked, how can strangles in free-roaming ponies on common land be managed better? Currently, are there ponies with strangles on Dartmoor?
Are there ponies with strangles on Dartmoor? Yes. Oh, I don't know. But if I had to sort of, if I'm answering that question, I think that's a really hard one to manage. But if I had to manage it, then obviously you'd want to try and round up all those ponies, part of that group. But it is a little bit like how long's a piece of string. You don't know what other ponies have been in contact, but at least if you can get that group of ponies into a contained area, and then ideally get your vets to test them, hopefully that you can catch it as early as you can. But that is a very difficult one. That's a good question. But that's, I think.
And Roxane, I suppose, by definition, they're going to be at less risk in many ways, just in terms of the environment in which they're living.
Absolutely, and I guess maybe the management of them wants to emulate Iceland and generate a closed herd population system, particularly if there is strangles and they go to the effort of eradicating it from the group. Then the major thing is not then reintroducing it to the group with a rogue carrier that's introduced. So absolutely. Difficult though.
Closed herd and Dartmoor aren't often used in the same sentence. I wouldn't imagine. You touched on vaccine, Roxane, and Chelsea's asked, in the US, the strangle vaccine is a nasal spray. Do you have any information on this? If it's effective as the one in Europe as an injection?
I'm afraid I know absolutely nothing about that vaccine, so I would recommend speaking to your own vets about the degree of protection that it affords, and things like boosting intervals, and also your risk analysis. So if you're low risk, then it might be that you can adequately control the spread of infectious disease using other methods. It's looking at the preventative measures you take versus the level of risk that you have, and being sensible about it. Otherwise, if you wanted to avoid all infectious diseases, like we know, we would stay in our houses and never go anywhere, which is not really compatible with most people's existence.
Well, I don't know, the last year, most something different. Sara, Polly's asked, what strength disinfectant is sufficient to decontaminate surfaces? Let's assume, obviously, we pressure wash, so they're broadly clean now from organic matter. What strength disinfectant is sufficient?
I'm not sure what the actual strength is, but I mean, when we use our Burcon, it is very specific on the tub as to the type of thing that you're disinfecting. I don't know, Roxane, do you know the actual measurements with that? But it does tell you specifically if you're doing it for something like strangle, or you're doing it for general disinfectant, it will tell you exactly that.
Yeah, 100%. So that would be my recommendation, is check that your disinfectant that you are using is effective against the bacteria that you are targeting. The nice thing is strangles is not a particularly resistant bacteria. It's usually quite susceptible, so most disinfectants will work against it. And follow the manufacturer's instructions. Do measure out your disinfectant because you want it to be effective, and also look at contact times. So quite a lot of disinfectants will have a contact time where they need to be in contact with the surface, so that might be 10 or 20 minutes in order to be effective. So there's no good just spraying it on and then washing it straight off in some instances. So just following those manufacturer's guidelines for your product is the most important thing.
Absolutely. Roxane, Elizabeth asked, can a carrier be identified with the strangles test?
Yes. So it depends which test you use as to how likely you are to identify them. I'm going to assume that that's the blood test. So as time goes on with carriers, the blood test is likely to become less sensitive at picking them up, because all the blood test is telling us is that our horses have had exposures to strangles at some point in the past and therefore might be a carrier. They're not telling us, they can't differentiate recovered horses that are not carriers from recovered horses that are carriers. So that's important differentiation. So what we're looking for is, if we get a positive, then we know our horse has had strangles at some point in the past, and therefore it might be a carrier, and that's when we would have to do a follow-up test with a guttural pouch wash and endoscopy to have a look in those guttural pouches and see what was in there and see if they are carriers. So they might be positive on bloods but negative on our guttural pouch wash, which would mean that they were not carriers.
Brilliant. Thank you, Roxane. Sara, Paula has asked, would you recommend isolating any horse on a large yard that has nasal discharge as a preventative measure?
Yes. The answer, yes, I would. If we've got any horses that are in our herd, it doesn't matter if they've been there a year, 2 years, and we see any sort of signs of something that might not be right, it comes straight out and goes straight into an isolation area so that we can just monitor it. And I would say yes, if you can do that, definitely.
Brilliant. Claire's asked an interesting question here, Roxane. If you're working with other horses beside the isolated one with strangles, given that strangles and some other respiratory viruses can be transmitted by humans in their nasal passages, even if we don't catch them, is it sensible to use a face mask when handling them, particularly as we are now much more comfortable wearing them? Well, I think we're much more used to wearing them. Whether we're much more comfortable wearing them, I'm not sure. But the serious point of the question is, would face masks be helpful here?
Potentially yes and no, I think, is the answer to that. I think the risks of transmitting particularly strangles in things like nasal passages are very slim. And the risk with it is generally, even though we are more used to wearing face masks now, it can make us touch our faces more when we're wearing face masks, which might actually increase the risk. So if you're a person, and most people do it completely inadvertently, so even being aware that that's a risk sometimes doesn't prevent it. So I would say it's much better to pay attention to what you're doing with your hands, make sure that you're not touching things that you shouldn't with your hands, and you've got good hand and foot hygiene, and that your outer layers are changed, than it is necessarily to wear a face mask.
Yeah, it's a really interesting point. And we had so much last summer, didn't we, around COVID? And I'm not sure if wearing a gown would fit in the same here, but there is some view or opinion, and informed opinion, that, you know, wearing something like a face mask gives you a false sense of security.
Yeah.
So, but probably best not, I guess, is what we're saying, and just make sure you're, in other areas of biosecurity, you're being really, really careful. Roxane, you've touched on this. Ellie's asked, how long does the bacteria survive outside the body on buckets, gloves, elsewhere?
So up to 6 weeks is the answer in the right conditions. Generally, it doesn't like being dried. So as long as it takes to dry a lump of snot is probably how long it survives on most surfaces. But when it's kept moist, so if we've got particularly damp corners, or water sources, it will survive longer in those. So generally, probably in the normal environment, a couple of days. But environmental spot decontamination is really important. So water sources and buckets, anywhere where it's likely to have high nasal discharge contamination, it's really important to keep those clean and disinfect them really regularly. And then any areas that you find in your isolation, if you've got a horse that's discharging any snotty areas, clean those up straight away. It's going to reduce the contamination and spread. Brilliant.
Melanie's asked, is strangles an equine condition only, or can other animals catch it? No, strangles is an equine only condition, but as you already said, all equines. Ellie's also asked, Sara, in terms of symptoms, is the temperature higher than with other respiratory infections? What's your experience at the farm?
Well, luckily, and touch wood, we, in the sort of 12 years that I've been here, we've only had a handful of the symptoms come out with a lot of our horses, and it does tend to be the temperature goes up. So your normal temperature is going to be around sort of 37.5, 38.5. So anything that's sort of 2 to 3 degrees higher is a slight fever. Anything with a high temperature is going to be sort of 3 degrees more than that. But you need to know what your horse's baseline temperature is first, because so many horses vary and take it at the same time every day. I don't, with regard to other respiratory problems, I would imagine the temperatures, you're probably going to see other symptoms from strangles as well as a high temperature to know that it's strangles and not something else. But as soon as you get that temperature spike, you need to then address the other things and obviously get your vet to have a look at that horse.
Roxane,
but take your horse's temperature first.
Yeah. Yes, I think that's such a good point, Sara, is to know what's normal for your horse. 100%. That's a really good tip.
Brilliant. Finola's asked, is strep equine still a notifiable disease? And I suppose, given the fact that this is an international webinar, you need to know well. But from a UK perspective, it's not a notifiable disease. But I'm going to turn that question round, Roxane, because people so often ask, why isn't it a notifiable disease?
It's a good question, and I think because it's endemic, and generally, I suppose what would the benefits of it being notifiable be? And arguably, it would potentially improve recognition and understanding of the spread of strangles. But what quite often happens is it actually just reduces people's openness with communicating about it if there's potential consequences for doing so. So I think that's the counter argument to it remaining non-notifiable is actually we'd probably some more chance of controlling it through better education and good cooperative care when it comes to disease outbreak than it would be to make it notifiable. Generally, I mean, there is the paper in 2021 looking that's been published looking at the global spread really does highlight the global significance. So I think there is an argument for making it notifiable, certainly at a global level as well, because it is a very significant disease. But whether that would have a big impact in the UK on actual spread and control of disease is a different question.
Yeah, I think you raised a really interesting point. In fact, the Chief Veterinary Officer for Scotland last week, her view was, well, if we make it notifiable, you have to tell us as the government, and then the government is going to tell you to do things, and that's the way it works. So actually, as you say, I mean, potentially making it reportable globally, so we can get a better sense and be able to measure it better, or get a better feel for its epidemiology would be so much better. Listen, it's been great. We'll carry on with a few more questions. I just wanted to say. Some of you will know Professor Derek Nottenbelt, who is probably clinically. I mean, he's an absolute nutter, and I'll prove he's an absolute nutter because tomorrow morning he and his colleagues are starting a 24-hour CPD, continuing professional development webinar, and it starts, I think, at 8 o'clock in the morning. And most appropriately, Josh Slater, some of you will know, is talking about on managing equine disease outbreaks, and that goes at 8 o'clock, 8 a.m. And you don't have to stay up for the 24 hours, and not all of the talks will be relevant or of interest to you, but we're putting a link in now. Vets of Horsepower has been going over a decade. They've raised hundreds of thousands for charities, and they're supporting 4 charities this year. Normally they drive around. Clearly there's a pandemic, so they can't do that, so they're doing it on a webinar in 24 hours. So there's a link there. Please, £10 donation, and you'll have access, and you don't have to stay up all day. You'll have access to it afterwards. So Deej, I think it's Deej, has asked what is the normal temperature for a horse, which we've covered off. Is there any point using the strangles blood test as a screening test to decide whether it is safe for a new horse to come onto a yard? And that's come from Facebook, Roxane.
Yes.
There you go.
It isn't the gold standard, so we'll not pick up as many carriers as guttural pouch endoscopy will, but it is still better than doing no testing. So you'll still pick up way more carriers by doing the blood test than you would by just monitoring, but you will not pick up as many as if you chose to do guttural pouch endoscopy instead, or as well as. So I hope that answers it. And I think there's a really good point about all things biosecurity is just because you can't do it gold standard doesn't mean you shouldn't bother doing anything at all. The more measures you put in place, the more effective you'll be at disease control. So it isn't a case of all or nothing. The more you do, the less risk you'll have.
Yeah, I meant to say that after Zara's presentation, 2 points that really hit home with me: forward planning, or having a plan of action in peacetime when things will go wrong, and also, the more you do, the less risk there will be, and it's not an all or nothing thing. But that's a great point. Thank you for that, Sara. Question from Facebook. I think it was said that quite often horses with strangles may show only a nasal discharge without even a fever. Should I get any horse with a snotty nose tested for strangles?
I think you should isolate it, like I said just now, and then you could get it tested for strangles, or you could just monitor it if you keep it in isolation for that 7 to 14 days. And see if anything else develops. Take its temperature, because that's a telltale sign. Roxane, would you add anything to that, or any different?
No, I think we probably all know horses get snotty noses for a variety of different reasons. I think if you're unsure, I would just recommend that you speak to your own vets about what the risks are, that it might be strangles, and whether it's prudent to do a test or not.
Yeah. Absolutely. Brilliant. Question on Facebook, one for you, Roxane. Would you advise a yard to require a guttural pouch wash to show carriers as a standard procedure?
I would certainly advise yards to have a process for introducing new horses in terms of isolation, quarantine, and potentially screening. Yes, it would be ideal if you would guttural pouch wash any new arrivals coming onto the yard where you had an uncertain disease history, but it's not going to be feasible in all instances. So I think actually just having that disease control program in place, including how you introduce new horses, and speak to your vets about developing that, what's going to be right for your yard, because I think that's a really important point as well. It's got to be feasible, it's got to be achievable, otherwise no one's going to do it.
Absolutely, yeah, great point. Sara, Helene has asked, if you have a positive case of strangles, which measures would you take with other horses in the yard? Take temperature every day as a control? Thank you for your presentation, it was great. But anyway, so what measures would you take if you did have a positive case?
I think, as we said about using the strategy, the traffic light system, so segregate, obviously depending on how many horses you've got on the yard, separate them into ones that haven't been in contact, which are green horses, put them in one area, potentially out in the fields. Your amber horses that have been in contact, monitor them really closely, temperatures twice a day. And those that either have been in contact and are showing disease, put them in another area. So everything is isolated, everything is locked down, and then monitor all of the horses with the temperatures being taken twice a day. And obviously if you get one in your green area, move it out, that if it has a temperature, into your amber or red.
Brilliant. Question on Facebook, is it, for Roxane, is it unpleasant for a horse to have a guttural pouch lavage?
No, it's fairly non-invasive, so it's probably not the most comfortable procedure to have a endoscope popped up your nose, but it's not painful, and generally it'll be done understanding sedation, so our horses will be less aware of what's going on. So generally there's no reaction to it. The only thing I would say is if you're having guttural pouch washes done, if you can encourage your vets to be nice by maybe warming the solution up to room temperature before popping it in. Otherwise, I think if it's particularly cold, then it can give them a little bit of an ice cream headache sensation. And there's lots of nerves and other structures that run down the guttural pouch that probably don't like being exposed to very cold water. Yeah,
good point. Someone's asked, what costs does it? What is the cost of having a guttural pouch lavage?
Generally, it will vary, so I would just speak to your own practices about the cost of that. Usually it will be a couple of £100, including sedation, but costs do vary. And then if treatment's required on top of that, then obviously that might be an additional expense.
Which is why, you know, biosecurity and trying to prevent it happening in the first place is always so much better, isn't it? Is it, question for Roxane, is it safe to vaccinate a horse against strangles if it has equine asthma or some respiratory condition?
Generally, I would say yes. There's not too many contraindications as long as the horse is generally well, but in every individual case like that where there is, I would always speak to your own vets first for advice about whether that's the right thing to do for your horse.
Brilliant. And I meant to ask earlier, you mentioned the intramuscular vaccine that's due to come onto the market. Do you have any insight into when that will be?
I think it's progressing quite well. I don't actually know when, but I think it's relatively imminent.
Relatively imminent, and that's great. Because I mean, but I think the key point you raised earlier is that even if we get a decent vaccine, it's not going to be the silver bullet that solves us from the problem of strangles, is it?
No, it's still going to take good biosecurity, isolation, quarantine, all really important, just as important as vaccination and disease control.
Brilliant. I love this question. How did you teach Audrey to bring in the washing?
It was a training assignment that I had. I did a master's in clinical animal behaviour recently, so it was a training assignment. So yes, lots of hours of patient training, and in exchange for carrots.
Brilliant. And it's a question that's just come in. Obviously these are quite invasive procedures, guttural pouch washes and such like. Is there anything we can do to train our horses to be more relaxed and to be less stressed by them?
Yes, absolutely. Beaver have some great videos, the Don't Break Your Vet videos that I think are on YouTube, which are fantastic presentations about how to prepare your horses for veterinary examinations and injections. Generally, I would say even relaxed horses will probably benefit from having some sedation just to help them be relaxed during the procedure. It's also very helpful, especially when you're doing lavage, is to actually have a nicely lowered head, so that gravity helps with drainage as well. So it's good to have their heads down. So yeah, having a horse that's used to being handled and is relaxed and happy with injections, I would say, is the key points there.
Brilliant. And in fact, Basil's just put in the link to the Don't Break Your Vet series, British Equine Veterinary Association, Beaver, and the link there. And there's a whole host of some really fascinating videos there. So well worth a watch when you have a moment. Maya has asked, is there any health conditions that horses can have that prevent it from getting the vaccination? As you said, you know, that's one to consult with your vet, isn't it?
Absolutely.
Yeah. Brilliant. Listen, we could go on, but we're getting towards the end. So I'm not sure I warned the two of you, but I'm going to give you 10 seconds warning now. We've obviously covered a huge amount of questions and you've given us two excellent and practical and informative presentations. Sarah, if I come to you first, what would be your final thoughts be in terms of sort of the rallying calls for people to go away with?
I think I'd say don't panic and don't put the fear of God into people, but just go and have a look at your yard, have a chat with your yard owner or yard manager, or even at home, and just see what they would be able to do if the worst case happened and they did have a strangles outbreak. Just look for a procedure, because I bet there are a lot of yards out there that don't have that in place. And I just think it's really important, coming from seeing the horses that we have come in and the procedures we use all the time, you know, touch wood, it works. The isolation, so definitely do it, definitely isolate.
Brilliant. Yeah, thank you, Sarah. And Roxane, what final thoughts from you?
I think that don't be complacent is probably my main point. That it can happen to anybody, and just because it hasn't yet doesn't mean that it won't. So having these measures in place, really thinking about your biosecurity, and it's not just strangles, it's other diseases as well. Having a biosecurity plan in place is a really, really good idea. It's going to help protect your horse and improve its welfare, and seriously reduce the stress in your life as well, because any infectious disease outbreaks are difficult, challenging, and often expensive.
I think there's a couple of really good points there, isn't it? The fact that the measures you take to prevent your horses getting strangles is going to help protect your horse against, and your yard against, a whole, well, pretty much every equine infectious disease there is going. And also, I think that was another really good point, Roxane, the fact that it is not failure. You know, we've seen from the last year, people can take all the precautions they can and will still get COVID. People take all the precautions they can, and now equines will still get strangles. So it is absolutely not failure. And obviously lots of information tonight about what is failure is doing nothing about it, isn't it? I suppose that's probably a good way of putting it. Listen, thank you so much to everyone for your questions. We've managed to get through most of them tonight, and which is a great credit to Sara and Roxane for answering them so concisely and so effectively. So thank you for that. And it's really great. Now remember, we are going down to one a month over the summer, a little bit of time off for good behaviour maybe. And so our next webinar is going to be on May the 26th at 7 p.m. And that's going to be how to provide a good life for horses, the importance of friends, freedom and forage. And we're going to have Professor Nat Warren, who many of you will know, and also Sam York, who's a producer of young horses and a very experienced event rider, and a member of the World Horse Welfare Team, yet to be picked. So really look forward to, you can sign up to that and register for that on the chat function there. If you have been inspired by tonight and would you like us to do on some other topic, then please do send through your ideas to education@worldhorsewelfare.org. And so it only leaves me to thank Sara and especially to you, Roxane, for this evening. It's been brilliant. Lots of really supportive, great webinar. Thanks so much. Probably about sums it up. Highly informative. So thank you for that. Thank you to you both. Thank you to everyone again for joining us. Hope to see you again on May the 26th. In the meantime, if you're in the Northern Hemisphere, I hope you'll enjoy the longer days if you're not too near the equator. And if you're in the Southern Hemisphere, I hope your coming winter isn't as wet as we've just had. Although being in the UK, we always love talking about the weather. A month ago, it was very wet. Now it's very dry. So thank you so much for joining us. Wherever you are, take great care of yourselves, and we'll hopefully see you on May the 26th. Goodbye.